The diagnosis of COPD requires you to differentiate it from other conditions with similar symptoms. Understanding the nuances of differing diagnoses is crucial for ensuring proper treatment and management of patients presenting with respiratory issues. The most common presenting symptom of COPD is shortness of breath, but there are many other important diagnoses to consider in such a case. Whenever I think of exertional shortness of breath, I first think of anemia and its risk factors like gastrointestinal bleeding, heavy menstrual cycles, malnutrition, cancer, or the use of blood thinners. Fortunately, you can screen for anemia with a physical exam and blood work. Shortness of breath can also be the only presenting symptom of a heart attack, particularly in older patients, females, and those with poorly controlled diabetes. Blood work will show an elevated serum brain natriuretic peptide level, a biomarker for heart failure, as it's released when there is increased pressure in the heart. An electrocardiogram, or ECG, and troponin blood test can be used to confirm the diagnosis of a heart attack. Similarly, shortness of breath, chest pain, swelling, and hypoxia can also suggest a possibility of pulmonary embolism. Typically, these patients present with tachycardia and have risk factors for or evidence of deep vein thrombosis. A D-dimer test has great sensitivity for screening for pulmonary embolism as it measures the presence of D-dimer, which is produced when blood clots dissolve in the body. A computed tomography or CT angiogram can definitively confirm this diagnosis. Another common feature of COPD is edema with shortness of breath with exertion, but this sounds a lot like congestive heart failure. The distinguishing features of congestive heart failure are crackles on auscultation suggesting fluid in the lungs and a chest X-ray showing an enlarged heart and pulmonary edema. Cough and sputum production with shortness of breath should include the differential diagnosis of pneumonia, bronchiectasis, and tuberculosis. Patients with pneumonia often present with cough and fever. The physical exam and chest X-ray are specific to pneumonia. Bronchiectasis is a lung condition where the airways become damaged and permanently widened because of repeated infections and inflammation, making it hard to clear mucus. This creates an environment that breeds bacteria and can lead to frequent lung infections. Bronchiectasis can be caused by many things like cystic fibrosis, autoimmune disorders, gastroesophageal reflux, and immune deficiency leading to recurrent pneumonias. The suggestive feature of bronchiectasis is large amounts of purulent sputum and chest imaging showing bronchial dilation. And in the setting of a chronic cough, fatigue, and weight loss, you have to think about tuberculosis. You should consider tuberculosis in areas of high prevalence. Findings of tuberculosis on a chest X-ray will show infiltrates, like a collection of pus, and scarring in the upper lung zones. But you will need microbiological confirmation to diagnose tuberculosis. Asthmatics also present with shortness of breath, chest tightness, wheezing, and airflow obstruction. Often they've been diagnosed earlier in life, and there is a family history of asthma, along with allergy and skin symptoms like eczema. The symptoms of asthma vary from day to day and are based on environmental triggers. This variation is reflected in the airflow obstruction, which is both variable and reversible. If the differentiation is unclear, spirometry will distinguish between COPD and asthma. Importantly, asthma and COPD can coexist in the same patient. If a concurrent diagnosis of asthma is suspected, medication therapy should primarily follow asthma guidelines. As a matter of fact, please recognize that patients can have COPD and congestive heart failure, pulmonary embolism, anemia, heart attack, asthma, or pneumonia all at the same time. When evaluating the differential diagnosis of COPD symptoms, your tools include chest X-ray, ECG, blood work, and ultimately spirometry to confirm that there is fixed airflow obstruction.
So I hope you liked this video. absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.